at 6 weeks after surgery in a standard missionary position with the woman beneath the man, I think it's safe to return to gentle, cautious sexual intimacy. I think that other positions can begin to be explored at 3 months after a higher level of soft tissue healing has occurred. I think that during all these, I think that following hip replacement, patients need to be cautious and be cognizant of the hip precautions outlined by their physicians and try to be careful not to exceed those during the course of intimacy.